I'm Samantha Deshaunick with CDD, and I'll be your moderator for today's webinar, Structure-Activity Relationships and Additivity, Going Beyond Conventional Wisdom. I'd like to briefly introduce our expert panelists, and please refer to the CDD blog for a more detailed description of their accomplishments. Today we have Dr. James Guy Breitenbucher, who has over 20 years of experience as a medicinal chemist in the pharmaceutical industry. He's worked at UCSF, Axis Pharmaceuticals, Johnson & Johnson, Dart Neuroscience, and is currently VP at Convelo Therapeutics. Dr. Peter Gedeck is a senior scientist here at CDD and is a part of our research informatics group. Prior to collaborative drug discovery, he worked for 20 years as a computational chemist in drug discovery at Novartis. Before we get started, I want to let the audience know that you can ask a question at any time using the Q&A button on the Zoom toolbar. We'll save time at the end for our panelists to answer any of your questions. So Guy and Peter, thank you for being here today. It's great to have you. To start, could you briefly comment on the traditional goals of SAR analysis and the conventional ways in which it's been done?
Okay, well, let me maybe start with this. If you look at the past, there were kind of different ways of viewing data. So on the one hand, you could focus on a single compound and visualize the compound together with a larger set of data. Then very often you also see a comparison of, let's say, 4 to 5 compounds with, due to the constraints in the size, with just a few data. And then there are, of course, tables where you can look at many compounds in the rows and the data are in the columns. But then very often, because due to the lack of throughput of assays, you only have few data for some of the experiments. So it's there's always this trade-off. More recently, well, more recently is probably also 10 years plus, of course, data visualization has been introduced in the drug discovery process to more tightly bring together a graphical visualization of your results with a more tabular visualization of the results.
So what's perhaps being overlooked then?
Well,
go ahead, Peter.
Okay. I think when you look at, I think very often when you look at a series of structures, sometimes you see multiple changes at different positions in the molecule, and it's not really the best way, and we will see today why this may not be the best way to compare compounds in a series. So I think it's much better to look at a consistent change in a structure, and then of course also what has been very overlooked, and that's mainly, I think, well, it's kind of probably the lack of the availability of the tools if you want to look at, compare combinations at 2 points in a molecule, so more like a matrix type representation.
Yeah, I think it's still, you know, even with all of the kind of modern visualization techniques, I still think that medicinal chemists are challenged with the ability to really glean information from all of these visualizations. We're definitely better than we used to be, but I think there's still a ways to go.
Yeah.
Could you describe the concept of additivity and the assumptions that are usually made with it?
Yeah, so if you go to the next slide. So additivity was a concept that was first recorded in the literature by Freed and Wilson in 1964. And it's a very simple concept. It basically, you know, this is a little SAR table from their paper. And what it basically says, if you're changing 2 R groups in a molecule, when you change R1 and you get an increase in activity, and you change R2 and get an increase in activity, that when the idea is that if you change both groups, you should get an additive increase in activity of the 2 individual groups. And so it was the very first concept in QSAR recorded, and in this period of time, there was a lot of debate about whether this was actually a true representation of SAR. And even Free and Wilson, in their own paper where they discovered this concept, they even wrote at in the end of their paper that they didn't think that all SAR would be additive.
I think we have some examples to show on that as well.
Yeah, so we were running a project at Johnson & Johnson. Well, we were running a number of projects at Johnson & Johnson when I was there, where we made full matrices of compounds. And we started to learn that, you know, how often non-additive SAR was actually part of the program, and it was fairly frequent. And so here's an example of some orexin antagonists, and this graph takes a little bit of orientation, so I'll describe for the audience that, you know, the vertical height of each bar represents the activity of that compound in units of pKi, and each of the bars represents a different compound with one R group represented on the x-axis and a second R group represented on the y-axis. And so the yellow bars here represent a very typical kind of SAR investigation where a medicinal chemist might take R1 and change it along the x-axis and find the best compound, which is that compound at the intersection. And then say, okay, well, now I've found the best R group. Now I will explore my R prime groups. And when you do that, you find the compound on the far right is the most potent compound. And kind of the tacit assumption that a lot of medicinal chemists make is, well, I've now found the best compound of all these possible compounds because I'm assuming additivity. And so if you flip to the next slide, the gray bars represent the assumption that the medicinal chemists are making. They assume that all of these gray bars have to be less active because the activity here is additive. But we actually made these matrices, in this case, go to the next slide, and what we found was that the actual data deviated significantly from what you would expect if the SAR was additive. And in fact, we found a compound this way that was 3 orders of magnitude more potent than it was supposed to be given the additive assumption. And so things are happening here in this additive assumption that can really affect medicinal chemistry programs. And we also found that when we went and researched a bunch of papers that did medicinal chemistry in a linear fashion, we found very few cases where people actually went back and checked to make sure that their additive assumption was actually true.
So then how general is additivity in SAR?
Yeah, it's hard to quantify, right? So there really hasn't been very many papers on this. Peter was just telling me about a new paper that's come out by Christian Kramer that might address some of this. There was a paper by Janssen in 2008 where they took 19 different SAR data sets that were relatively complete and tried to build QSAR models that were additive around these data sets, and found that around half of the data sets that they have could not be fitted to an additive model. So, you know, this would suggest that non-additivity is a fairly frequent occurrence.
Could you predict when additivity is more likely or less likely? Are there any signs?
I mean, we've probably looked at a dozen different programs doing these matrix SAR. And, you know, it seems like when the core of a molecule represents a lot of the energy of the binding of the molecule, that those data sets tend to be more additive, but it's really hard to make generalizations.
What about anything specific to protein properties themselves?
Well, I guess it always depends on how how your pocket is defined. If you have a very well-defined pocket, which is really rigid, then you can expect more additivity because, well, because you don't have larger structural changes. But if you have a flexible pocket where you can see whole loops change their conformation, you will see a non-additivity. And I think the type 2 kinase inhibitors are a very good example where the loop change suddenly opened up opportunities to gain selectivity, and the activity definitely is non-additive in this case.
Yeah, I think it's interesting that some of the best, some of the most important stories in our industry involve, these kind of unexpected findings of big protein movements, like the kinase example that Peter was talking about.
Very good. Well, I think at this point we should set some time for our first poll. And for that, I'm going to hand the internet microphone over to Charlie, our question master.
All right, everyone. For our attendees, we've just launched a poll here, and we are interested in knowing whether you have seen non-additivity in your SAR work. So please respond yes or no, or perhaps you have seen it in others' SAR that you've been aware of or really haven't thought about it. So everyone's doing a great job voting. Very good, very good. We'll let them still piling in. Give the attendees a few more seconds to cast their vote. Seem to be at a steady state now, so I'm going to end the polling in 3, 2, 1. All right, everyone. As you can see, yes, the yes answers have it at 53%. So 53% of our attendees who voted here have seen non-additivity in your SAR. Pretty strong showing here for haven't really thought about it too. So maybe that's a good vote and a good time since we're having this webinar today. But any thoughts on these results, guys?
I'm actually kind of pleasantly surprised that some people do see this phenomenon.
Yeah, I think it's interesting. I mean, it's a very common feature, but I think it's also interesting to see that 30% didn't really think about it so far. And I think the main reason for that is that it's the additivity. In order to identify the additivity, you have to identify these quadruplets of structures and determine if the activity in this case is additive or not. So I guess it's easy to spot when you have a really dramatic change like this, 10 nanomolar, pKi of 10, which is femtomolar. If you suddenly have a jump like this, then you know, yeah, there's something non-additive happening. But if you have just small non-additivity, or you have, to a large extent, you have additivity, but then only a few cases where you have non-additivity, the tools we usually have aren't really amenable of identifying that. And I think it's also the case that we don't not necessarily synthesize matrices to a larger extent, like Guy has done in this J&J study.
So then so our audience has seen non-additivity. What's the con then to synthesizing the full matrix of SAR groups versus just a subset? When would you want to do one versus the other? And is it different in theory versus practice?
I mean, I think, 20 years ago when I started in the business, people thought it was a burden to make the whole matrix. I think, we have so many good, high throughput purification tools, and, synthetic methods have improved. I think it's not as much of a problem to build whole matrices as it used to be. Although, I will say if your SAR is demonstrating to be additive, it's harder and harder to justify making a whole matrix. But like Peter said, it's the occasional outlier that really provides the most information. And so always keeping an eye out for those outliers is important. Do you have that, Samantha, do you have that slide on the papers?
Yeah, I do.
Yeah, so a few years back, our team just went through and looked at, the most recent, this was back in 2008, the most recent, SAR papers in the literature. And, after looking at 500 different SAR papers, we only found 4 where some semblance of a matrix was actually made so that you could check for non-additivity. So that's why the poll question kind of surprises me, because 95% of our papers assume additivity, but 50% of the people have seen non-additivity. That's interesting.
I would also be interested to see if the people who voted and said they have seen the non-additivity, if they have seen it mainly because they had a lot of crystal structure support in their project. Because then, of course, once you see loop changes, then you can see that. Or maybe you see conformational changes in your ligands because you introduce a magic methyl which freezes a conformation, or you introduce an intramolecular hydrogen bond which otherwise wasn't there, and again you freeze a preferred conformation. So it would be interesting. But I think it's easier to spot when you have a crystal structure, but much more difficult if you look at an SAR pattern.
Yeah, that's a great point, Peter.
How do you think that the crystal structure patterns and SAR patterns can work together to fill in any holes in the data?
Yeah, so we had an example just like this. I think that's the next slide, right, Samantha? Yeah, so we actually published a paper last year. We had done maybe, like I said, a dozen programs where we had seen non-additivity, but this was the first program that I was on where we were actually able to structurally verify the reason for non-additive behavior. And so in this case, we had this PD2 scaffold we were working on, and we had 2 different R groups, the orange one and the blue one there in the structures. And you could see that the activity increased when we increased the size of the blue group. It also increased when we increased the size of the orange group. But when we increased both of them, the activity did not increase commensurate with the additive theorem. And this is represented in the bar graphs here, where bar 3 is smaller than it should be. That's just a graphical representation. And so if you go to the next, we then went and made the whole matrix of compounds. And I don't want to go through the predicted and actual data, but the graphs on the right here are the calculated non-additivities of each molecule in the matrix. And you can see that there's a very clear and consistent pattern in data where when you combine 2 larger groups, you're losing activity that you'd think you would get if you looked at each of the groups independently. And this gave us a lot of confidence that there was non-additivity present in this system. And one of the things Peter and I have talked about in the past is it's one thing to see one pair of molecules not be additive, but it's quite another thing to your confidence if you see half a dozen pairs that are non-additive. That really tells you that there's something interesting going on. And so then we got the crystal structures of these compounds. You can see, and what we saw was that there was a very clear protein movement of one of the residues. So when you had a large group on the right, the leucine 770 was shifted to the left, and when you had a large group on the left, the leucine was shifted to the right, and the protein just couldn't accommodate 2 large groups because this leucine had nowhere to go when both the groups were large. And so that was the source of the additivity, was this protein movement. And So we were very excited to see that you could actually use your SAR trends to predict structural changes.
Great, and it's time for our next poll. Take it away, Charlie.
All right, thanks, Samantha. So for our attendees, I've just launched the second poll, and we're interested in knowing your perspective about the hardest part for optimizing SAR patterns. You'll see here a few options to vote upon: logic, synthesis, biology, or informatics. So what would you think would be the hardest part, or what have you found to be the hardest part in optimizing SAR patterns? So a lot of great activity here. The attendees are just voting away, and there's not a clear winner, but it's coming out. It's always very exciting to watch.
Yeah, we made bets what we will see here.
All right, it seems the voting has kind of subsided now, so I will end the polling in 3, 2, 1. All right, sharing those results. So the attendees have felt that the hardest part for optimizing SAR patterns is indeed the biology, your target identification with biological assay being an indicative model of the disease at 43%. Informatics and logic bringing up the number 2 and 3 slots. Any surprises here, gang?
I think Peter and I predicted exactly this outcome.
It's true, you had your crystal balls.
But there's not real, I mean, okay, biology is the clear winner here with 40%, but it's still pretty much everything, and it just reflects that drug discovery is a really hard business, and everything needs to fit together.
Actually, it is interesting that the biggest one besides the biology is the informatics to handle complex data. So that probably fits in really well with the next part of our.
And as a computational chemist, I would of course add the first and the fourth together, and then we are at 46, and then it's the clear winner.
All right, thanks everyone. I'm going to make the results go away. Thank you so much.
So I just want to give a final reminder to the audience to keep submitting your panel, your questions to the panelists. I've seen a few roll in already, and they all look very exciting. But to get back to the questions from me, what types of tools are currently available for SAR analysis, and what are the pros and cons? And maybe this gets into the idea of informatics being the second hardest problem.
Okay, I take this now. I mean, there are of course various software tools out there, and I'm not naming any because we are a software provider and there is a competition as well. But they are usually very good, or all of ones I've tried. Very often, however, they are much more focused on experts, and it's very hard sometimes to, you know, when you have a large diversity of tools available, to keep track of what you want to do and which one to use, and then very often you forget how to use specific tools and so on. Guy, do you want to comment on that as well?
Yeah, I still think that even though there's been a lot of advances in tools, I mean, one of the things that I think is hardest is this kind of idea of molecular disconnections to come up with matched pairs and to do this kind of matrix analysis. We kind of did these things on the fly, and there's not really many tools available that could allow you to do these things.
And I think, so just mention the disconnection, and I think these are kind of examples how you would like to analyze your SAR. So on the left, you want to see how does activity change when you modify the substituents of the ring system, and you can see, well, the structures are pretty small, but you can see that the top 2 ring systems and their substituents are this consistent within the series, and the modifications happen only on the lower ring system. So looking at a series like that allows you to have a more consistent view of your SCR. Sometimes you also want to see what is the effect of changing the core structure. And you can imagine it's, if you have a data set of a few thousand compounds, finding these examples where only the core has been changed, and then see if there's a consistent effect on activity, but with this core change, is pretty hard. And then, no, go back. The last one is then when you have modifications on more than one side, so a typical R group decomposition. How to do that? You know, it always depends on what tools you have available. There are tools that have that, there are tools that don't have that. And so at Novartis, when I used to work, the standard data browser did not support an R group decomposition. So that was unfortunate. But mainly there might be ways of approaching this, and we thought about how to do this. And as you can see, there's a consistent pattern in these for answering these individual questions. There's always a part of the molecule which remains the same. So either a connected fragment, or in this case, where we look at the core, the middle one, we have a disconnected fragments that are identical. So if you go to the next one, we looked into taking the structures and fragmenting them into fragments, and then here shown on the left, and we currently now proof of concept, we looked into cutting ring linker bonds. So in this case, the structure then fragments into 1, 2, 3, 5 different fragments. And then we can enumerate all possible substructures, connected substructures in this case. You get a variety of substructures, and then we can arrange these subgraphs or substructures in a lattice based on the substructure relationship. So this fragment associated with this node is a substructure of the one above. And then we can combine all these molecular subgraphs into a huge lattice for a very big, for a big data set. And we looked into ways of querying this data structure. So we can go to the next slide, and we can answer basically all of these questions. So we can identify cores in your data set, so fragments that have a large number of associated structures. Because of course, if you have a data set and you make consistent changes around the, let's say, around the central ring system, then that will be a core, and almost all compounds will have this. Then we can look at a single point change. So we can start from a fragment that has only one connection point, and then look at the molecules associated with it. We can also identify core replacement. That's a bit more complex to query this graph, but it's possible. And we can look at two-dimensional libraries. So when we start with fragments with 2 connection points. And this then leads to an automated additivity analysis. And we will focus now on this part, because the others are more interesting for navigating your SCR, but the additivity analysis is the core of our webinar today. So if we look at this structure, and then we take the, so this is from the PDE2 paper, then we look at this central ring system. We find there are a number of single point fragments, and then I can combine them, and I get, in the end, I get the R group matrix out. This is a very nice way of doing it. And then, of course, we go to the next slide. We can look at in this fully enumerated library, we can do the classical additivity analysis by looking at adding and subtracting the PKIs or the PIC50s of the structures. And then we can look at the distribution and identify outliers and so on.
So what's the advantage of running analyses over the full data set, and where do we go from the examples you showed us today?
So this is an interest. I mean, and I have to refer again to Christian Kramer's publication that came out this week, because it's, you know, you can run this additivity analysis over your full data set. You can, and he showed, for example, that you can get information about the experimental error out of it, which I found really a great result. But you can also, and I'm sure I'm very sure we can see this, where you can see subsets of your structures where the SAR is additive. And you can go to the next slide. You can show this on this PD2 data set. So this reflects a bit what the slide that Guy already showed as a bar chart. So this is more, it's a heat map, and you can see that the rows is one substituent and the columns is another substituent. And you can see that it kind of falls into two sets. And if you look at the activity profiles for changes along the one of the R groups, you can see that there are two sets of activity profiles, one for hydrogen, fluorine, methoxy, and one for O-isopropyl, O-isobutyl, and O-30butyl. And that shows you that if you stay in this group, for example, your SAR is additive, so you can make certain assumptions here. In this here, the SAR is also in this subset, in the top one. The subset is also still additive, slightly less, but it's still additive. But of course, if you take the full data set, the additivity assumption fails.
Yeah. This is kind of an interesting, I really like this way of visualizing the data. It really clearly points out where the trend broke. And you know, one of the things also about what Peter's talking about is, you know, it's really the examples that I always show were, you know, they were made for publication essentially, where you know, we made the whole matrix and we designed it from the beginning and analyzed all the data. But a lot of the ways you might want to use a tool like these is to dissect data or sparse data. And, you know, what Peter's talking about allows you to pick out those additivity cycles within sparse data to kind of look at trends as well.
And you can see this on the next slide. So this is a slightly different data set, and this is a bit of a messy graph, but each point in this graph corresponds to a molecule. And you have R groups on one coordinate and R groups in the other coordinate. And when you analyze this, you can identify fully enumerated subsets. And this is just shown here. So there's a fully enumerated matrix in there of 4 times 8 molecules, 4 times 8 R groups. There's another one with 3 times 10 R groups. And just being able to get these out easily, that will be a real advantage. And I think the big challenge will be, how do we actually integrate this into a user interface in a complexity simplified way? So here's a mock-up that we did once. So you could imagine that you have a structure, then you select a group, and then you say, okay, show me compounds that have modifications at that point. Or you do run a free Wilson analysis of the data set. Show me the contribution to the activity. That, of course, assumes additivity, and may require that we have several free Wilson analysis for additive subsets, but not for the full data set. And then, because we can go to an R-group analysis. Here's another mock-up, and that looks a bit more like it might look like in CDD Vault at some point. So you have a structure, there's a little filter icon which comes up, and then you click it, you see the relevant fragments that are relevant for your data set. Because we have seen that the fragmentations that we get are, you know, for a simple molecule, you can easily get 60 different fragments. But in the context of the data set, not all of them are really relevant. So you may find a a subset of these fragments which all have the same molecules associated with it. And in this case, you only need to look at the largest one because all the others are redundant in this case. And then you could, so in this case, you can create this type, these fragments, these interesting fragments, and you can pick one, and then the interface would show you all the structures with this fragment. In this way, you can navigate your structural space in a way which is more amenable to SAR analysis.
Yeah, that's really exciting, Peter. So I want to give the audience a chance to digest that and at the same time start to think about what they might answer for our next poll question.
All right, everyone. So attendees, we have a question for you again. If the free Wilson, together with more sophisticated additivity analysis, similar to what you were just seeing, were automated so that you could just click on your data to pull it up, how impactful would that be for you? So, game changer, moderately impactful, not impactful at all. Maybe I'm not sure because I'm not involved with SAR optimization, or I'm not sure for a multitude of other reasons. Please let us know your thoughts. Lots of voting going on, neck and neck for a couple of options. I don't know if we'll be surprised here. I'm watching them come in. Come on, come on. All right. Seems like the races are calming down now, and I will end the poll in 3, 2, 1. Thank you, everyone. As you can now see, a majority of our attendees voting thought that that ability would be moderately impactful. Nice to have, might help sometimes, but really the impact might be small or infrequent. What do you guys think about that feeling?
I think it's great because I've talked to at least 3 different software developers to try to stick an additivity analysis in their tool, and they all resist me. So I'm super excited by this.
Yeah, I agree. I mean, I think it will be very interesting to have that in a way that is easy to use. But as I said, that's the big challenge.
Perfect.
So switching gears just a little bit, I want to ask, what's the difference in SAR optimization for proteins versus phenotypic screens? And what's the benefit of this new type of analysis?
Yeah, so I was fortunate enough in the last couple of years to be doing a number of phenotypic programs, and you know, I learned a lot about data quality and standard error, and because these phenotypic screens have a lot of error, and you know, it does make it harder to do things like additivity analysis. But on the other hand, you know, when you have a phenotypic screen, you can't get structural data because you don't know the target. And, you know, so these additive trends in my, you know, in my perfect world, at some point we would be able to take these additive trends and actually do really interesting things in dissecting the biology of a phenotypic screen. For instance, if I had, you know, a trend of a series of compounds that was very additive, and then there was a break in the trend, you know, that might be the place where I would look for a change in, say, the pathway that we were interacting with or the target that we were interacting with. And so I think in a lot of ways, it would be very hard to run a phenotypic screen, or I'm sorry, a phenotypic program without making matrices of compounds, because you really need that reliability that comes from repetitive matched pair analysis. So, you know, I think there's a real place for it here.
So I'm looking at the questions that's coming in, and we have quite a few. So the discussion's been really interesting so far, and I hate to cut it short, but I do want to make sure we have time for the questions. So Charlie's been watching them very closely, and What do you have for us, Charlie?
Yeah, all right. So we have several questions here from the audience. First one is kind of a clarification. Someone was wondering, are non-additivity and activity cliff synonyms, or are there some subtle differences in those concepts or terminologies?
I think an additivity cliff or an activity cliff does not have to be the result of non-additivity, but probably most non-additivity is an activity cliff. Is that, if that makes sense?
Mm.
Well,
I don't know. I mean,
it's large.
no, I disagree here.
Okay.
I think activity cliff. I mean, you know, if you grow an art group and at some point you just get too large for the pocket you grow into,
Right.
then you basically your activity drops drastically, and this is an activity cliff. That does not mean that suddenly your binding mode changes.
Right.
It's just your compound becomes less active, and it still may be that a change in another position is just additive to that. Non-additivity is usually more related to structural changes in the protein or in the preferred conformation of a molecule. And you could have non-additivity with highly potent compounds, and you wouldn't see a cliff in this case.
Perfect. Thanks, guys.
Yes, I changed my answer. I agree with Peter.
Awesome. Good discussions. There's probably no perfect answer. Are there perhaps ways of getting at non-additivity other than accounting for proteins' conformational changes? So non-parametric machine learning other than linear regression. And is there a role for more advanced molecular mechanics models that accommodate things like short range or many body effects such as polarization? Any thoughts on kind of methodologies for getting at non-additivity here?
Well, that's a lot of question. I mean, ultimately, I think the goal of the medicinal chemistry, of analyzing additivity with respect to, say, a pKi of a target is to ultimately get at an understanding of how the molecule is binding. I'm not, there is definitely non-additivity that's due to other things other than protein movement. And Peter mentioned for sure one of them, which is conformational changes induced within the molecule's, ground state, or a change in the rotational dynamics of different bonds and things like that. So you definitely can have additivity, non-additivity that doesn't have to do with the protein moving.
And with respect to the machine learning, if you have enough data, a nonlinear method should capture it, because then it should be able to differentiate between two sets of molecules. But that assumes, of course, that the additivity, that you have enough examples of the second set. I mean, we've seen in the example where you just remember the activity profiles, where you have a subset of molecules that shows clear additivity. In this case, a linear model just for that subset would work. And it may also work well enough for the other subset. And if you have a large enough data set, the nonlinear machine learning method would be able to differentiate between the two sets and capture that.
Perfect, thank you. All right, when you have protein structure data, either complex or not, do you find that the rational drug design is more effective or quicker?
I give that question to Guy, because
Thanks.
I worked on a project with crystal structures in my life, even though I worked for 20 years in the industry.
Yeah, so I think, well, I have a very controversial answer to this question, actually. And you know, so just take it as opinion, of course, is I do think that structure biology enables medicinal chemistry, but I think sometimes not to the extent that we think, right? And so Peter and I were talking just before the webinar about, you know, that chemists tend to, you know, psychologically they have too much reliance on crystal structures to the extent that they maybe don't pay as close attention to data trends as they should when they have a picture to look at. And, you know, Peter made a great point. These pictures are also estimates, right? Sometimes the density is not, you know, is not appropriate for making the kinds of decisions that the chemists are making. It's just a model. So I don't know, Peter, if you want to say more about that.
Yeah, I mean, that's exactly the case. And there have been studies in the literature where people looked at published crystal structures and with published densities. And sometimes, you know, you have the density is not sufficient to really place the ligand, but of course there's a placement because the structures are optimized, the crystal structures are optimized using a force field. And so in a sense that is one limitation. It's just a static snapshot. The quality may not be sufficient enough. We don't capture the dynamics of based on a single structure. And if we limit our SAR exploration with the crystal structure, we may not push the protein far enough to give us a bigger loop chain. You know, when kinases came up, I think this is such a great example. Everybody said, oh, you can never get selectivity in kinases. Of course we can now. Now we know it, because now we know that we can push the kinase to just change. And that is, if you believe the structure too much, you may limit your options.
Yeah.
So I think having both together is useful. And Guy had a really nice example where the crystal structure supported the data and the data supported the structures. And you make more structure. You usually get data more easily than you get the structures.
Perfect. All right, I have the feeling this next question may be somewhat of a trick question for you guys, but I'm going to throw it out here. Do you think building and testing these compounds to determine additivity or non-additivity is more effective than high throughput screening techniques?
I don't think it's the same. I think they're different things.
Yeah.
You would never, I've never used additivity in the sense that I used it to design molecules, you know, to find the first hit or something like that. I think, so I don't think additivity replaces high throughput screening in any way.
No, I agree. I mean, of course, what would be interesting to look into what is the most effective way of exploring the additivity or non-additivity, because you know you showed in the first example from J&J that, and that I've seen that as well in the past. You know, you start with a structure, then you change one side of the molecule, and you get a series of structures, and then you get to a very good compound, then you explore the other side of the molecule. And you don't really want to fill in all the combinations of these two R groups that you could make. So what is the most effective way of filling in blanks in order to test the assumption, or test if the compound class would be additive or non-additive in your assay?
Yeah, actually so when we first came up with this, I had a friend who was an engineer who was in statistical design of experiments. It really started to make me think about, you know, how might you optimally fill a matrix without making the whole matrix? And, you know, it's very, very complex because statistical design of experiments is done with parameters that are very well defined. And things like, you know, a change from a from a chlorine to a methyl involves change of a lot of different parameters. And so, it's not so simple to come up with an easy equation to know, how full a matrix is full enough. But I think it's a really cool question.
Mm. Yeah.
Great. All right. So what about additivity and non-additivity happening together for different parameters? For example, potency seems additive, but protein binding free fraction isn't. Have you come across situations like this?
Yeah, I mean,
Yeah.
yes. It's clear. I mean, properties like log P are definitely additive, except maybe some intramolecular hydrogen bonds. But usually, it's, log P is very well predicted using an additive linear model. Yeah, and I think what we also will see if we run an additivity analysis for a larger data set and focus on, we will see additive subsets, we will see non-additive subsets. And if we look at a different activity at the same time, this separation will be different, or this partitioning of the data set will be different.
And this is, we haven't yet played with this too much, but, this idea that one set of compounds would be additive, say, for some anti-target, like Peter was bringing up that recently the Chris Kramer paper had characterized hERG as being relatively additive. Well, that's pretty interesting, because then if I'm trying to get selectivity for hERG and I know that I have a pretty good chance that's going to be additive, if my PKI for the target I like is not additive, well, there's the basis for your selectivity. Right? So, I think this can be used in lots of different interesting ways that, really haven't been articulated that much in the literature.
Good. So is there any truth in the statement that additivity analysis is more likely to manifest in a cellular assay more frequently than in an enzymatic assay?
It's a great question, and I have no idea.
No idea.
All right, so maybe that's one of those to be determined in the future questions.
Yes.
Well, I think I will have one more question and send it back over to Samantha for wrapping everything up today. We had a question from the audience about current data visualization tools, like there's a visualization tool that's part of the CDD Vault platform. What tools are available, or what tools would you like to add to our suite of tools to really work with this type of additivity data analysis tasks?
I think that's a Peter question.
Yeah. Yeah, I'm currently thinking about how to embed the additivity analysis, or rather non-additivity analysis, into CDD Vault, or in this case also into the CDD Vision. I mean, what is kind of straightforward is to use the fragmentation as a way of selecting or filtering compounds in CDD Vision. Once we have the ability to say, okay, this subset, if I pick a compound, for example, it would be interesting to know which other compounds around are additive with, which other compounds show additivity with respect to this one compound. I mean, this would be something we just need to try out and see what we get. I'm pretty sure that it will open up ways of looking at your data which we have not thought about so far.
And that's actually kind of what I'm most excited about. I'm most excited about the idea that we can maybe look into things that we don't even know we can look into yet.
Yeah.
It's all great insights. And since we're coming to the end of the time, Peter and Guy, I'd like it if you could each leave the audience with one piece of advice or one take home from today's webinar.
Well, mine's pretty simple, which is, you know, I really think it's valuable to a medchem program to evaluate additivity in your SAR. I think I've seen that in many programs now, that the most interesting learnings are the ones that come from data that you don't expect.
Yeah, I agree with this. I also think just always expect the unexpected and never stop exploring your SCR, because you assume that certain things are a fact. Always push a bit beyond the limits, what your assumptions are.
Great. Well, thank you again, Guy and Peter, for joining us today. Thank you, audience, for all your fantastic questions, and we look forward to collaborating.
Thank you.